Hi, I'm Nakul Jain, Director of Solutions, working with Wadhwani Institute of Artificial Intelligence. From a public health point of view, very recently in general the world has realized that because of availability of superior compute, a lot of data that has been collected because of a lot of digital systems that have been put in place, there is an opportunity to work on a lot of things with respect to public health. As of today, there are multiple areas that are leveraging artificial intelligence in public health, starting from diagnostics, screening, which could be image-based, could be sound-based. Then there is an entire concept around clinical decision support that leverages the concepts of artificial intelligence for triaging purposes, for producing differential diagnoses, for providing treatment, to the extent where treatment could be personalized. Beyond that, a lot of efforts are being made in terms of surveillance and disease modeling, which is heavily leveraging artificial intelligence. Very recently, because of the introduction or because of this entire thing around large language models and ChatGPT, a lot of health assistants are now being sort of projected. There are possibilities of introducing these health assistants for different levels of different healthcare workers, as well as citizens that can genuinely use the power of artificial intelligence in their day-to-day life. So there are a lot of challenges when it comes to public health and artificial intelligence. Because we've been able to place a lot of digital systems out there, there's a lot of data that gets collected by different programs in the ecosystem, right? Data quality and data integrity continue to remain a challenge. For example, we've been collecting a lot of data around various health aspects, various programmatic data around different patients, different individuals. But then the way we've been collecting data, right, in a lot of these settings, might not be optimal to train artificial intelligence. We will need to build in, or we will need to deploy specific solutions in order to sort of make sure that the data that gets collected can be used to train artificial intelligence. The other problem that will usually public health or in general how these models face is biasness in terms of the data. So because the nature of the data is very complex and we collect a diverse set of data, it is very essential for us to make sure that there is no biasness when it comes to data. Otherwise, the artificial intelligence, the kind of results it will produce, will be very biased towards a particular outcome as compared to other, and that might not be the actual output that would be optimal for use in public health setting. The other issue that is very pertinent, especially in this setting, is ethical and legal consideration, approvals, accreditations, because we deal with a lot of sensitive data, we deal with a lot of proprietary data, we deal with a lot of data that gets collected from very different and diverse ecosystems. So it's very important for us to understand that what kind of product that we are building and how to make sure that we are building it in the most ethical format, we are making sure that we are following all the regulatory compliances, we have taken utmost care around data security and data privacy. All these factors need to be of high priority when developing these solutions, and this is a challenge. This is a genuine challenge that organizations usually face. The other challenge that we face is around integration and scalability, because again, while we develop these solutions, a lot of user centricity is at the core of it, right? But given the kind of population, the kind of geography that we live in, it's diverse, right? And each area comes with its own set of challenges, with its own set of pain points. So trying to create a solution that fits all, that works for all, obviously is challenging. Then deploying it in large scale, deploying it in production at scale becomes again challenging, because there are so many different systems, there are so many different processes, there are so many different programs, there are so many different ecosystems that exist on the field. It's very difficult for us to build something and deploy it across with that sort of uniformity. So all of these are challenges that need to be solved before we even think about deploying any solutions that genuinely create an impact at scale. Another dimension to challenges that we just spoke about is, of course, how to make sure that the solutions that are being built actually reach the rural population. Now, while all the challenges that we spoke about are obviously applicable to rural setting as well, there are certain additional problems For example, how do you even make sure acceptance? How do you even make sure adoption? How do you make sure that there's training that is happening on field, right? These are some of these pertinent things that are very specific to rural areas. We need to solve some of these to make sure that the solutions end up reaching the last mile and genuinely start benefiting the people who are actually in need for these solutions. Wadhwani AI is an independent not-for-profit institute which has been working since 2018 in the area of artificial intelligence for social good. We aim at serving the underserved population across the developing nations. Our mandate is fairly clear. Work with public, work with governments, understand the kind of pain points and challenges people are facing across various domains, including healthcare, agriculture, education, urban affairs, climate. Figure out solutions that where artificial intelligence can play a major role to solve some of these issues and build sustainable and scalable solutions that can impact all the people in the community. Our journey as an institute, even if it's not very long, has been very impactful. We have worked with various government departments and integrated our team within their ecosystems. We are today collaborating with Ministry of Health and Family Welfare, Ministry of Agriculture and Farmer Welfare. We are also working with Ministry of Education. We are working with different state governments across health, education and agriculture. We are working with National Skill Development Corporation and many other ministries. We are supported by some of the top donors in the ecosystem. As of today, we are working on 30 plus solutions across various domains. One of those solutions, which is clinical decision support, has already been integrated to the national telemedicine application of the country, which is eSanjeevani. And using that tool, the platform has already conducted 30 million plus triaging. There are other 5 solutions which are already deployed, and the remaining solutions are also in very advanced stages of development and deployment. As an institute, our mandate is to impact as many lives as possible. We want to be an applied AI institute. Our philosophy has taken a slight change in the last couple of years, where we have placed application of all our solutions at the core. Our ideology is to build solutions that actually go on field, get deployed and create a genuine impact. And that's what our future holds for us as well. We will continue to work with different governments, we'll continue to work with different developing nations, we'll continue to work with the community and the people and make sure that we impact their life in a positive way using some of the cutting edge solutions that we build.